So today we are going to be talking about the Telebrigade handbooks. Well, Sam's going to be talking about it. He's going to go over some important pages and what you need to know and all about that handbook. And then he's going to talk a bit about the itinerary, which is, I think it'll get you guys a little excited since not many of you had a chance to go over it, which is totally fine. Getting to see what days we get to do what day you get to do the dermatology station is a bit exciting. So I'm looking forward to that. And we'll talk about the group. So for Urban Clinics days, we're broken into groups. So we're going to learn who's in whose group. Then we're going to talk about Charla, which if you don't know what that is, just wait. It's probably going to be the best part of the meeting. That's all I'm going to say about it. And then we're going to learn about, really briefly, because I think this will be kind of a longer meeting, really briefly we'll go over how to share your experience after Telebrigade, because I guarantee it's going to be something you're going to want to tell your friends and family. And so just making sure everyone knows how to do that appropriately is really important. So I'm going to stop sharing and let Sam share his screen to go over the handbook. Everyone should have got that email from Catherine with the handbook. I see a few nods. If you want to pull it up and go over it with him, you can. If not, you can just, oh, right, sorry, Sam. If you don't want to pull it up, Sam's going to be showing it anyways. Okay, you're good to go, Sam.
Okay, cool. So yeah, like you guys all would have gotten this email from Catherine, and it's got a bunch of important information on it. And one of the kind of coolest and newest features that we have now is or things to look at anyway, is the handbook. So some of you guys may have gone through it already. It's pretty comprehensive. It's like 70 odd pages or something like that, 80 pages. And it's got everything that we're going to be doing in it, which is sweet. I know a lot of you guys had questions about how long the self-paced activities are going to be, and just sort of like what the overall thing looks like. Don't worry, we're going to be going through the itinerary after for a more sort of like concise summary, but I wanted to go through some of the more like, I don't know, maybe just some notable pages and examples, kind of like what you can expect, just so you've got like a better idea of what it is going into, especially if you've got exams leading up to the reading break and then it's like, go, and then all of a sudden we're on brigade, you've got no idea what you're doing. So like, first of all, on this second page here, you can find the links for each one of your Telebrigade sessions on this little link here. I'm not going to click it because it's going to totally screw my thing up. But you guys also should have gotten an email from Catherine, or a series of emails, which will kind of like be all the Zoom links, and they'll just go straight into your Google Calendar. So that should automatically be added, I think, depending on what sort of like email client you use. This is kind of an example. So some of the session days will have pre-session things or exercises that you need to go through. So this is just like one of those. So before, I believe, the first session, you can go through this and kind of look at some of the info that they've got here. Like, for example, this link will take you to all the rapid needs assessment data, and you can write down some of the information that's on there, and then you'll bring that into the session. They'll have some sort of like some dialogue that you'll be able to engage with our PA and everything, and it'll sort of prompt some questions and stuff like that. Kind of an example of what session one's going to look like. Obviously, we're going to be in a Zoom call. We're going to have like a presentation, and it's going to be fantastic. While we're in that, you're just going to be following along with the handbook, and all the information that, not letting me scroll super well here. But all of the handbook's basically designed that you can like follow along with the Zoom meeting and write stuff down. It's got space for like notes at the end. And this is just kind of an example of what that might look like. Fair warning, some of what you're going to be writing is going to be in Spanish. So like this would be an introductory statement for the community health workers about yourself, which you will prepare before one of the sessions. Don't worry, there'll be plenty of warning. But I mean, just so a heads up, just in case you, I don't know, were worried about that, you can definitely use Google Translate. I know I will. You can also email any of the PAs and the people that are going to be sort of like introduced. You're going to get tons of contact information and tons of opportunities to ask them. But any questions you may have, including Spanish questions. Let's see, 38. Oh, also, like, because we're kind of going into this, especially with the urban clinic that's live streamed, like this is real time sort of medicine that we're watching. And they don't want you to come out of this feeling like you've learned nothing about medicine. So this is just one example of some of the stuff that they're going to, like medical advice that you're going to be getting from the professionals about how to communicate in an appropriate manner with patients, with the doctors, sort of how to go through and like manage patient expectations and stuff like that. So they're definitely like keeping you in mind, keeping your knowledge in mind. And there's tons of great resources in here. There's also tons of great resources that are kind of like hidden in like little links and stuff all around this handbook. It's super interactive from what I found. There'll be another example that'll come up. But yeah, you'll be able to kind of like jump around and get some more information on there. I think 47. This is sort of a breakdown of what the urban clinic day will look like from a patient's point of view, in case you're wondering this. And this is, I mean, on the in-person brigades that we had, it's really apparent because you can literally see the patients going from one spot to another. It's got a great flow to it. But essentially, there's an intake, and this is where they get their medical forms checked and everything like that. Triage, which is sort of like a joint process between the physicians and the volunteers and the community health workers and stuff like that. Consultation, that's where they're talking to the doctor. Dental, vision, and gyno, those are pretty self-explanatory. And then pharmacy is the final stage that they go through. It's kind of the same layout in the urban clinic as it is on the in-person brigade for anybody that's already been on one of those. There's way more information about the clinic and stuff like that. You'll be able to find all that in here. Again, highly suggest that you take a look through this. There's some really cool things like all the technology that we're going to be using. So, I mean, some of it's pretty like basic, like a stethoscope, an otoscope, a pulse oximeter and such, but it's just cool to see how they've adapted it for use with telehealth functions in mind. If you're worried about your Spanish ability, and especially in sort of like even at like a very utilitarian level, page 52 has a bunch of information on that. There's YouTube videos, this Spanish packet. You can go through that, have it open like in another tab if you want. I would probably recommend that. Again, don't sweat your Spanish if it's not too bad or if it's not too great. Everybody's going to understand and nobody's really going to mind. I think here, maybe I'll relinquish my, actually, I guess one more thing before we go into the schedule and groups. I know some people had some confusion about the rural clinics. And because it's not live streamed, it's going to be pre-recorded, and but there is going to be sort of like up-to-date like case studies and stuff. And so this is just kind of an example of some of the stuff that we'll be following along with the presentation on during the rural clinic. I mean, these are some of the stuff that you can expect to hear, see, and learn about. But let me just see if I can figure out how to close this thing so I can, how the heck, there we go. Anyway, that's the handbook, or that's a little bit of the handbook in a nutshell. Highly recommend you look through it. Just make sure you like open it and like at least know where it is just in case, because you are definitely going to need it. It's super important and super interesting. The itinerary, I know a lot of you guys have seen this already, but this is essentially the breakdown, and here's a zoomed in version of it. Keep in mind all these session times are in Central Standard Time, which is 2 hours ahead of us. So the earliest day that we're going to have, for example, is session number 7, Live Urban Clinic day number 2, which is at 10 a.m. CST, which is 8 a.m. our time. That's the earliest we're going to have to kind of get going on one of these. Most of them are going to be at like 9 or noon. But yeah, if anybody has any questions, oh yeah, right. You're also gonna have access to this page, and all the Zoom links are here again, just in case you can find them. If anybody has any questions as to what these sessions are all about, definitely like ask me at the end of this, or ask any one of us. Well, I guess ask me at the end of this meeting, or take a look in your handbook. It'll give you a ton of information. I mean, I've gone through it, but I haven't read, word for word every single thing. If there's one thing that you're particularly interested about, definitely go through that. As for groups, these are the group breakdowns. You can see they're just made alphabetically by GB. But I highly recommend that you guys add everybody on Facebook, that you can start making like group messages and stuff like that, because these groups are not only going to be your urban clinic groups, but they're also going to be your Charla video groups, which Veda is going to talk about in a little bit here. So yeah, you can watch those. This is how, I hope you remember what your group number was. This is how the itinerary is kind of broken down for the urban clinic days, both the first and the second day. Again, these times are in PST, which is 2 hours ahead. So you can see everybody's going to have a chance to do everything here, just once, but I mean, that's great. And if anybody has any questions or concerns about the groups or about these, feel free to let me know, or whatever. But you guys also have access to this itinerary. It's in the email that you got from Catherine. Definitely, like, I don't know, mark that or like pin it or whatever.
Cool. Thank you. Oh, I meant to zoom in. Sorry, you guys. Sorry for anyone with bad sight like me. So thank you, Sam. We're going to talk about Charla now. So Charla, which I actually didn't know until I was making these slides, means chat. Is Spanish for chat. And it's essentially a short and interactive presentation done by us at each medical and dental brigade. And it aims just to teach the community members how to live healthy lives. So for instance, last year, we basically, you got put to a station. So maybe you were in triage, maybe you were in consultation. If you were in Charla, last year, we were in charge of a group of kids, and we taught them 2 things. We taught them how to wash their hands properly and why it's important. So we did some skits, used some glitter on our hands to show them how germs spread, and then also how to wash the germs off. And it's really cool because this is something that is so natural to us. We don't think twice, and it's something to them that is so new, and they don't realize the importance of it. So we got to teach them that, as well as oral hygiene. So again, brushing your teeth is something everyone does every day, but for them it's new and it's unique. And so we put together a skit to show them with these little toys how to brush your teeth, and then they got to brush their teeth, and it was really fun. And this was obviously the child version, but there's adult versions of Charla as well. However, obviously this year we won't be in person, so it's going to be a bit different. This year we will be providing the community members with an interactive and fun video to help them learn how to live a healthy life. This video is going to be played for them while they're in the waiting room at the urban clinic. So when they're waiting for their turn, this video is going to be on some sort of screen. And so we want it to be something catchy, that'll draw their attention, but will also educate them. And our task this year is to teach them about COVID-19. So as a group, I know everyone's not here. Maybe I'll just say last year what we did to prepare for our in-person Charla is one of our meetings, we made a bunch of poster boards writing out like the steps to washing your hands or why it's important. So what we're going to be doing is we're just going to be preparing today, but also trying to make our video with our groups. So it's got to be 5 to 10 minutes long. It can really include anything. So it can be a skit. It can be you singing. For oral hygiene last year, there was a song that we would sing in Spanish. Obviously, we're not doing oral hygiene this year, but if you can think of a song to wash your hands, or maybe there's one, do it. It's just got to be fun and grab someone's eye. And the thing is, it needs to be in Spanish. So I see that sounding concerned because I can't speak Spanish. However, I believe in all of you that you're able to, especially you, Nick. You might be pulling some slack for some people. Anyways, how we're gonna do this is we have 4 groups, which if you forgot your group, don't worry because you're gonna be put into a breakout room with those people. And if you weren't on the group because you're not going on Telebrigade, no worries. You're gonna be put into a group to help us. I know you won't be going on Telebrigade, so it's a little bit different. You may be wondering why you're doing this, but it's important to remember that all of us are active GB members, and no matter which Telebrigade we're interested in, whether we go on one or not, we're all gonna work together to help each other to reach our end goal. So group 1, you're gonna be making a plan to make some sort of video, some sort of PowerPoint slides, use your creativity to discuss what is COVID-19, how is it spread, and what are the symptoms. So obviously, I know there's probably a few science people in here. We don't need, every single thing about what COVID-19 is in science terms. We need for the general public that has like minimal education. So we need it to make sense to everybody, and it has to be in Spanish. So good luck finding hard English words in Spanish. Group 2, you're going to be doing who does it affect? So obviously it affects everybody, but kind of emphasizing vulnerable people, who's vulnerable, etc., and how it can be spread. So through contact, whatever. Group 3, you're going to be how to properly wash your hands. That's pretty self-explanatory, but I'm hoping this one is very creative. And, I will touch on that in just one second, Allie. And then group 4 is what to do if you get sick, what not to do if you get sick. So like the do's and don'ts of whether or not you're sick. And Allie just asked, is each group 5 to 10 minute presentation? No, this is going to be one video that we're all going to put pieces into. So in total, it's 5 to 10 minutes, which sounds kind of crazy, but again, we're just touching on general knowledge. Like it's supposed to be super simple, just like the basics of what you need to know. But again, we don't want just someone to be speaking Spanish while watching a PowerPoint slide that's super boring. We want to see people with their glitter in their hands, washing their hands. Maybe when you cough out glitter. That might be dangerous. But anyways, try and demonstrate whatever it is you're trying to teach them. I know it's going to be tricky. I've been trying to think about a way we can do this. And I do have some ideas, but I'm going to put you in those breakout groups. I want you to focus on your one question. So try to remember the questions. Maybe I'll copy and paste them in the chat so you can see them. But I'm just going to give you a few minutes. So introduce yourself, get to know each other, and make a little bit of a plan. Then we're going to come back and we're going to discuss it as a group and figure out, like finalize, okay, group 1, you're doing this, group 2, you're doing this, group 3, this, group 4, this, because we need to make it somehow that we can combine it and make it flow and make sense, while also touching on these important points about what COVID is and how to stay safe. Does that make sense? So each group's just doing a little part, but I want you guys to do some planning now and then we'll finalize it all together. This is kind of, we didn't get much information on this until a few days ago. And so it is going to be a quick turnaround, but I believe in everybody. Okay, Sarah, can you do the groups? Do you have something, Sam?
Yeah, just one more thing. So just like, I'm working on getting a actual sort of due date, like what date is actually supposed to be like done and finalized by. But the goal that we're setting for ourselves here is to have at least like a first draft and basically have it like everything but edited sort of before the brigade getting started, because we just don't want to be super rushed like while we're actually in brigade. I understand that everybody's got exams and stuff like that. But I mean, at most for each group, it's only 2 minutes and 15 seconds, I think, at max. So we'll just do, I think the hardest part's going to be brainstorming, and hopefully we should be able to get most of that done, like even just today. And then we'll just send in little videos.
Yeah, so I'll give you a little bit of time right now to brainstorm and meet people. We'll come back, we'll do a big brainstorm, and then you might have time at the end of the meeting to plan a bit more with your group and make sure you get everyone's contact info. I know everyone's stressed with school and stuff, but it will be minimal once you break it down. Like Sam said, 2 minutes per group. There's at least 4 of us per group. So don't worry and have fun with it. Sarah, go ahead with the groups. Okay, group 1. Tell us what you came up with.
Who would like to go for my group? Or should I do it? No volunteers? Okay, yeah, we were thinking that we might, there are two ways that we were thinking we might want to do it. We were thinking either some kind of like PowerPoint graphic, you know how you can animate cartoons and stuff like that in PowerPoint. I think that that might be easy. Or and kind of maybe do both, but as well like skits. So for our part, it would be like we would do the how is it spread and what is COVID-19 with some kind of PowerPoint graphic, and then kind of implement what are the symptoms with small skits, and then speaking over top of all that. We thought that might be the easiest way for us all to work on it. So I don't know if everybody else has done this, but we made a Facebook group for our group, and we're going to create a Google Doc just to work on the content as well for our section. So suggestions. For
That is
everybody
a
else.
good idea.
Cool.
Good job, group 1. Group 2.
I can talk, I guess. We also kind of thought, well, we hadn't talked about a PowerPoint, but regardless, if that's another group doing, we'll include that. But we talked about making a video with us all in it. And we especially talked about how the location of our video can be somewhere that the people over there that are going to be seeing our video don't necessarily see all the time. So like the ocean. And we talked about all getting together like socially distanced and wearing masks so we can all be in one location and doing the skits and the videos. And we didn't really talk about much about the information that we're going to talk about. A little bit though. We're going to have an emphasis on like masks and hand washing and about preventing the spread, just because those are easier to talk about to more laymanly than the actual disease.
Absolutely. That's a really good idea. I was looking at your question and who does COVID-19 affect? That's going to be pretty hard to act out. So I think similarly to group 1, you can maybe make a slide for that one and voice over it and then do your skit, which I think would be awesome.
Mm-hmm.
Cool. Group 3.
Oh, okay, yeah. So yeah, ours is going to be fairly self-explanatory. I think we're going to do like an actual like video of and we might be turning it into a music video of Happy Birthday in Spanish with potentially a choir of the 3 of us, and maybe a ukulele feature. I'm not 100% sure. We're going to iron out the details of that, but yeah, it should be pretty interesting. We're going to talk about the importance of soap, as opposed to like just straight up water, and like so go over some of the like, you know, finer points of maybe like intermingling thingies and stuff like that. So yeah, it should be fairly entertaining.
Perfect.
Sam, can I ask you a question really quickly? Do you know, is this an adult Charla or a children's Charla that we're doing? Because I know that's one thing that I can't remember if you had clarified that or not.
I am fairly certain it is a children's Charla.
Because it said it's going to be played in the waiting room, so it's mixed audience, wouldn't it be?
I do think it might. I believe it actually is an adult one. I'm just gonna change my.
Yeah, that might be definitely right.
This is here the guide.
Oh yeah.
Oh yeah.
Yeah, this is definitely adult education Charla. Yes.
Oh yeah, it said right here. Yeah. So
regardless, it'll be incredibly entertaining.
Yeah, still good knowledge. For any of you, this guide was in our email. Super handy. All the questions I pulled for the groups were in it, and it even has some examples in it, as well as this will probably be everyone's best friend, some common words or phrases, and then the translation. So obviously use these over Google, but for the things you can't find, maybe Google or just email our Catherine or whoever. Okay, and then group 4, let me just go back to this. That was my group. Zoe or Sierra, do you want to say something?
Yeah, I can say something. Yeah, so we were talking about maybe doing either some animation somehow. We couldn't really think of a way how to, but now that Cole's talking about a PowerPoint, maybe we'll jump on that idea. But either some animations or just some little like same thing kind of acted out scenes from our house that we could do. Yeah.
Yeah, I'll just add to Zoe's a bit. I think ours, not knowing this when I made it, but I think it might be one of the smaller ones. So we're gonna take on the intro and the conclusion, which I would like to hear everyone's opinion on this. but in the handbook it says to do some sort of intro of who you are. And obviously we can't all get together, but I think maybe it'd be cool if I could take a screenshot of us like waving, or maybe a screen recording of us waving. Like this would be kind of a cool intro, and someone could voice over like, hey, well, hola. I'm not going to try and do it in Spanish, but what do you guys think about that for an intro? Anyone, please feel free to give your feedback. Cool, thumbs up, that works. I was just reading the chat, and I was thinking similarly for the conclusion, again, it'd just be a video of us waving and saying thank you, etc. Was that time that you guys had enough to exchange numbers, exchange Facebook, and etc.? Cool. Well, everyone's first and last name is on the itinerary, so you can look them up and add them, not in a creepy way, but yeah, so I think we're set on that. The other thing I would like input on is that I did make a very vague outlined Google Slides. So I'll just show it to you all right now, because I figured some groups would want to use a slideshow. And so, oh, can you guys see the blue? This, yeah. Okay, so I was thinking I could give everyone access to this. And so you can work, obviously adjust the theme, do whatever you want with it. Work from here to answer your questions or to provide your content. That way, you know, it's all in the same place. Someone's gonna have to edit it all together anyways. So I think maybe this is the best way to do it. Anyone that has any crazy formatting skills or ideas, please feel free to take over. This was a last minute thing. Are we all on board with that? Thumbs up. Okay, I'm gonna put this link in the chat. Oh goodness. So I'm pretty sure anyone with this link can edit it, but let me know if you can't. And cool, let's get back to the rest of our meeting. Okay, are we back to the slides now? Okay, so any questions about Charla, please feel free to ask at the end. I'm just gonna go over some stuff really briefly. And yeah, I hope you guys are all excited and gonna have fun with it. So I'm gonna go over, like I said, how to talk about your experience or what to do and what not to do when sharing it on social media. This is just as equally important as it would be if you were in person taking photos or posting photos, but we want to focus on the 3 C's, which is going to be consent, content, and then caption. So this goes with if you're like telling somebody about your story as well, but this is specifically for, I guess, posting, just the examples. For consent, obviously you want to make sure anything you're going to be taking a picture of, anyone or anything you're taking a picture of, I guess anyone, you're going to want to ask for consent. Obviously you don't want to take photos of somebody in vulnerable positions, or you want to make sure that they're okay with you, because you wouldn't want to be on the other side of the screen and somebody screenshotting it and you not wanting that. So make sure you're always asking if you can take a photo, and then also asking if it's okay for you to post it on social media. And as you can see here, not knowing how to ask is not an excuse not to. Obviously, we can figure out how to say that in Spanish to make sure we are getting consent. For the content, you want to make sure that what you're posting is actually going to be representing your experience, and you want to think about how you're portraying yourself and others. This kind of relates back to volunteerism and portraying yourself as a hero, which we don't want to do. We want to make sure that our intentions are clear when we're posting and we're trying to share our story. And obviously, you don't want to be taking photos of anybody in vulnerable situations. There's no photos or recordings allowed at the Urban Clinic days. And that being said, on other days, you know, maybe you're talking with some community health workers, or I don't know who you're going to be talking to, but if you want a photo, maybe you can just ask, can I have a photo? Can I take a screenshot of this? And then you can take a screenshot and have a cool little Zoom photo. But again, make sure you're always asking. And then for our caption, it's similar to content. You want to make sure you're representing the situation or the story, and you want to make sure you know the name and the backgrounds of what you're posting. So instead of posting something along the lines of, oh, hey, here's a photo of me helping out some people in Honduras over reading break, you're going to want to know the specifics. You're going to want to know where you were. You're going to want to explain to everyone what you were doing, because it's obviously not clear who Global Brigades is, what they do, how they differ from, oh, I don't know what just happened. Can you still see my screen? Okay. I'm trying to get to this certain slide here. So I am going over this briefly, but know that these slides are available to you, because I know for me, after going through this talk last year, I was like, oh goodness, I do not want to post anything on social media. What if I do something wrong? However, just refer back to these slides. It's really easy. Go to my Facebook, look at my post. You just want to make sure people understand what you're doing. And it's hard to tell people, especially after going through it and learning everything. But just making sure we're portraying ourselves accurately is the big thing. And here's a nice little sheet to refer back to. So what you want to do, what you don't want to do, again, just ensuring that we're not making this look like we're the heroes in anything, and that telling our story, like telling why Global Brigades is so important, what we did, etc., etc. I hope that makes sense. That was pretty quick, but in terms of what everyone needs to do before our Telebrigade, which I think it's Wednesday today, our Telebrigade is less than a week away. Everyone needs to watch the Foundations video. It is 11 minutes long, but has good information. The pre-Telebrigade webinar is also super important. It tells you everything you need to know about how to connect to the Telebrigade via Zoom or Google Meets, as well as talks about some ethics and confidentiality. So that is a must watch as well. It's only 4 minutes. Like Sam said, review the handbook. Make sure you download it, because you are download or print. Maybe don't print. It was 70 pages. We're going to have to save some trees here. Download it so you can type in it and you can have your Spanish script ready. Review the itinerary. Get to know what you're doing each day. Again, I know we're all very busy right now, but try and get all these done before our Telebrigade. And lastly, very importantly, make the Charla videos or slides or whatever it is you're making. Did anyone have a chance to click on that Google Doc and see if you can edit it? If not, maybe I'll just ask Sarah or somebody to just quickly do that and check. Okay, cool. She gave me the thumbs up. So I guess everyone has access to that now. So if for some reason you can't get a hold of one of your group members, maybe you just write in the screen, hey, give me your email, and then you can find their email and you can message them. Does anyone have questions about anything? I know our Telebrigade is right around the corner. There may be some things that we're not sure about. Please ask away. If there's no questions.
I have one question. It's
Yes.
like kind of I don't know if it's a bit weird, but I don't know how to understand the rural clinics. Are these clinics that exist year round all the time, or are we bringing in like a pop-up clinic? I understand the difference between like how many Canadian physicians are going over versus how many already exist like in the community.
I can answer that at least in part. So like one of the big chunks of what we are providing in terms of like funding goes to ensuring that there is, I think, I can't remember if is it weekly or monthly trips from physicians who reside in the larger city centers like Tegucigalpa into some of the smaller rural communities. The brigade clinics that we had, like the in-person ones, those are somewhat more infrequent, but like there's definitely rural visits from physicians that are, it's either weekly or monthly. I can't remember.
Yeah, I'm happy to hop in, just I think maybe to clarify a little bit more, Alex. So normally these rural clinics that we bring in, that we were on in-person brigades, we go into a community and then we set up a rural clinic in, like, for example, the last 2 ones that we were in was a school, and then we provide services out of that school, and they bring in physicians from from Tegucigalpa or GB physicians in, and then we work with them. The urban clinic is completely brand new. It's just been built this year, and it's providing the same services, but it's year round, providing care for like underprivileged urban families in the community. So like in Tegucigalpa rather than in these rural areas, and they just provide cheaper services. So what Sam was saying about what we're paying for now is part of what Global Brigades is trying to do is transitioning out of these kind of infrequent clinic options. So, you know, before, the only way that they could send in a brigade is if they had or open up a clinic is if they had a brigade going, right? Like a brigade had to be going to that community in order for them to bring these services to the community. And what we're doing is they're transitioning to a model, which is part of it being more sustainable, is they now have monthly visits to these communities, regardless of whether or not students are going. And so that's part of what they're doing. So as far as the urban clinic goes, that is going to be a year-round care facility that's open, I think, 24/7 for urban families. The rural clinics are still going to be on a monthly basis because it does take more for them to bring, you know, these services to these communities. But I believe now, like Sam was saying, it is going to be monthly.
Thanks. That clarified a lot. I was just really curious because I was, I don't know, describing it to people, and I feel like that was a realm I didn't quite understand yet. People were like, "Oh, so are you going into a town for the first time? Like, do other groups go there? Like, do they have a brigade every month?" So that's great. Thanks.
I think we'll learn a lot about it as well in the telebrigade. But yeah, for the most part, it is you know, they provide these services to the rural communities as often as they can. But normally it's on a few months basis. But now it's going to be monthly, hopefully.